we're going.
Okay, the first muscle that we're going to be looking for is the latissimus dorsi, which is found along the back and side of the cat. So you're going to need to make sure that you clear off as much of the fat adipose tissue and the fascia material so that you can see this diagonal line here. This is the line of the latissimus dorsi. It's a fairly thin muscle, so when you go to lifting it up, you're going to want to make a shallow cut here where you see the natural line of the muscle. So just cut a small portion here, maybe about an inch or so that you can get underneath here, and then put your probe in here so that you can see where the natural separation is, and then cut along that muscle, and then you should be able to lift it up, putting your finger underneath to separate the latissimus dorsi from the muscles underneath. As you move up further, you should be able to see where the muscle is going to separate from other muscles. You're going to go up about this far. There's another muscle, the next one that we're looking for is the xiphi humoralis. So you don't want to go up any further than this, where you'll see that the xiphi comes in and connects to the latissimus dorsi. You'll find that there are some nerves and blood vessels underneath. Those are minor ones, so we're just going to push through those. And so for your dissection, you're going to want to make sure that you're through the fascia material and can see the latissimus dorsi all along the side of the cat. Okay, we'll be looking at that further when we do the back muscles. The next muscle that we're going to find is the xiphi humoralis, and that muscle is a small muscle, kind of rectangular in shape. This would be the bottom of it here. So as you lift this up from the chest, it's a very thin muscle, so you're going to want to be careful with it. It connects to the xiphoid process. Right in here is where the xiphoid process is, and then it also connects to the, blends in with the latissimus dorsi right here. So you're going to want to find that muscle, then you're going to separate it from the pectoralis minor. So as you pull it down, you're going to see an area of adipose tissue here. That's where it separates, so you're going to make an incision here and separate this up to the latissimus dorsi. So this is all of the separation for the xiphi humoralis. When you see this adipose tissue along the top of the cat here, you're going to want to remove that. So use your scalpel judiciously, make sure that you're only cutting through the adipose material, and you can dispose of that, but you'll be able to see the muscle fiber a lot better if you get some of this off of there. All right, so muscle number 1 has been found. You could clean it up a little bit better than this. Now we're going to be looking for muscle number 2, which is the pectoralis minor. In humans, the pectoralis minor is a deep muscle. In cats, it is not. It just lies a little inferior to the pectoralis major. And again, the more of the adipose tissue you get off of the cat, the easier it's going to be for you to see the separations here. All right, so if I extend this over here, I'm hoping that the camera can see that there is a line that's running right along here. Okay, that is the line between the pectoralis minor and the pectoralis major. It's a little difficult to see, and sometimes you have to kind of pull the arms out, extend the arms to find that separation, because the pectoralis major will be lying superior or superficial to this muscle. So after you find the xiphi humerales, you're going to come underneath here. Okay, and when you come underneath, you're going to be able to see or feel from the underside here a little bit more where this separation is. And as you pull it down, you should be able to see the line right there is what I'm looking for. And these two muscles will blend in together, so we're just going to separate it like this. Okay, so now we have the xiphi humerales, the pectoralis minor, and now we're going to find the pecto antebrachialis. This is a muscle peculiar to cats, and it is not found in humans. I'm just removing a little of the adipose tissue here. Alright, that muscle is the bottom or inferior aspect of that muscle runs right along here where my finger is. And so usually that's the easiest way to separate it. It sits on top of the pectoralis major. So, and it is a fairly thin muscle. I'm going to get underneath it. And separate it from the muscle below. Alright, then when you pull, after you get underneath here, you're going to pull to look for the other side of this muscle. And if you have your partner to hold this other arm, that will be very helpful to you, because this muscle goes all the way, and you can see it best if you can extend the arms here. Okay, so and then you're going to be peeking underneath here to separate it from the pectoralis major. Alright, I think it's best to work on the clavodeltoid at this point, and then we'll be able to see the upper part of the pecto antebrachialis a little bit easier. So as you're looking in through here, you're going to be looking for a line for the shoulder muscle. And when you pull it down, the line for the shoulder muscle is right there. And that shoulder muscle is, in humans, we just refer to the shoulder muscles as the deltoids, and that's it. In cats, we're going to have 3 different deltoids, which the only one that we'll be able to see really well on the shoulder here is the clavodeltoid. But once we find that, then we can separate this side of the pecto antebrachialis. So right here is that I'm running my finger under. This is the pecto antebrachialis, and then underneath that, this muscle here is the pectoralis major. I'm going to and the pectoralis, remember the pectoralis muscles are the ones that move your humerus, so they're attached to the humerus here, And so we just want to be able to separate them. So one more time, pectorantebrachialis, and then this one that extends under this whole muscle is the pectoralis major, right there. Then you have the pectoralis minor muscle right here. Both of those are going over to the arm as well as the pectorantebrachialis. Then you have the ziphiohumerales, and the ziphy connects to the latissimus dorsi, which you should have separated here. Okay, then we're going to go up to the shoulder muscle, and we're going to find some muscles up here. So you need to make sure that you have pulled the skin off of the neck of the cat here, because we're looking for the clavodeltoid here. So we have to go a little bit to the back side. We'll see a line right here, and then another white line right there. So we're going to come underneath here, make a little incision along the natural separation line here. Okay, so there is a muscle going up the neck here. You should be able to come to the other side of that muscle, right in here. And I want you to be able to get your probe underneath that. Then where this white line is here, that's going to change to another one of the deltoids here.